Key findings of a 2022 study. Can the way women clean their vagina affect the risk of early delivery? A recent study suggests it might. In 2022, researchers led by Laura E. Jansen published a study in PLOS One. Background. Why study preterm birth and hygiene? Every year, about 1 in 10 babies is born preterm, too early worldwide. Preterm birth, defined as birth before 37 weeks, is a major health concern. Doctors and scientists are always looking for risk factors to help prevent spontaneous preterm birth. An imbalance in the vagina's natural bacteria, known as bacterial vaginosis, BV, has been linked to higher chances of preterm birth. Certain vaginal cleaning practices, like douching, can disturb healthy bacteria and make BV more likely. Researchers wondered if vaginal hygiene habits could be a risk factor for spontaneous preterm birth. The research team at Amsterdam UMC designed a case control study to investigate this. They compared 79 women with spontaneous preterm birth to 156 women with full-term births. All the women were from 2 major hospitals in Amsterdam and were studied between 2018 and 2021. Data collection. After giving birth, each woman filled out a detailed questionnaire about her vaginal hygiene practices. They reported what they typically did before pregnancy and what they did during pregnancy. The questions covered common practices, including vaginal washing. Did they wash with just water, use soap, or a special vaginal gel? Intravaginal douching. Did they rinse out the vagina internally? Vaginal steaming. Did they practice vaginal steaming? They also noted how often they did these things. The study found a significant difference in one habit between the preterm birth group and the full-term group. Most women stuck to washing with just water. Over half of the participants, around 60%, used only water both before and during pregnancy. Using only water was not linked to any increase in preterm birth risk. A smaller group used vaginal gels. Women who used vaginal gels had a higher chance of experiencing spontaneous preterm birth. Using a vaginal gel was associated with more than double the risk of spontaneous preterm birth. If used during pregnancy, the risk nearly tripled. In simple terms, those who used these gels, especially while pregnant, were significantly more likely to deliver early. Other practices, like douching and steaming, were uncommon and showed no clear link to preterm birth. Very few women in the study performed intravaginal douching or vaginal steaming, and importantly, these practices did not show a statistical association with preterm birth in this research. This might be reassuring to some, but it's worth noting that not many women did these things, so there was limited data on them. To sum up the findings, using vaginal gel cleansers stood out as a potential risk factor for spontaneous preterm birth. Infections and inflammation in the genital tract are known triggers for preterm labor, especially very early preterm labor. These products might wash away good bacteria or irritate the vaginal lining, leading to infections. Women may want to avoid vaginal gels or cleansers during pregnancy. Gentle cleansing with water and mild unscented soap might be safer. Healthcare providers might start educating patients about this finding. Since many people assume using special hygiene products is a good thing, it's important to spread the word that in this case, cleaner isn't always better if it involves chemical gels inside the vagina. Simply choosing not to use a certain product is a relatively easy change if it proves beneficial. These findings are not the final word. The study itself calls for further research. Limitations, what you should keep in mind. Like all studies, this research has some limitations. Small sample size. The study included 79 cases of preterm birth and 156 controls. This is a decent number for an initial study, but we should be cautious about generalizing the results. Association versus causation. It's critical to remember that this is an observational study. It found a link between gel use and preterm birth, but it cannot prove causation. Self-reported habits. The data on hygiene practices came from questionnaires relying on memory and honesty. Researchers noted that some mothers might have underreported practices like douching out of fear or guilt. This could mean the real association might differ if reporting isn't accurate. No direct biological data was collected, as vaginal swabs aren't routine at those hospitals. The survey used wasn't previously validated, leaving room for interpretation. Many women, about 60%, said they wash with water. Likely at least some of them meant washing the outer genital area, which is normal hygiene. So it's possible that some respondents might have interpreted questions differently. This kind of confusion could dilute or skew the results a bit. The study would have been stronger with very clear definitions of each practice. Despite these limitations, the study provides valuable preliminary insight. The authors themselves emphasize that their findings should be seen as a starting point for more research, not the final word. Future studies can build on this by including larger and more diverse groups of women, and by collecting biological samples to see what's happening to the vaginal microbiome when certain products are used. Who conducted the study? This research was carried out by a team of scientists and doctors in the Netherlands. The study's lead author is Laura E. Janssen, and her co-authors are Ruben J.T. Verdoorn, Christiane J.M. de Groot, Martin A. Udik, and Marjon A. de Beer. They are affiliated with Amsterdam UMC University Medical Center, Amsterdam. It's always good to know who did the research. In this case, a reputable medical university team, as it adds credibility to the findings. There were no conflicts of interest declared, and the study did not have specific outside funding. In summary, this study suggests a potential link between vaginal hygiene products and the risk of preterm birth. The good news is that if this link is real, it represents a modifiable risk factor. You can read the full paper on PubMed Idaho 35771798. Always talk to your healthcare provider about safe products during pregnancy. Your doctor or midwife can give personalized recommendations. Sometimes letting the body maintain its natural balance is best. Stay informed and take care.